I tell my race ethnicity classes, I tell them the worst thing you can be that's legal in our society is a racist. Because you'd be stigmatized for that. It's not illegal to be a racist, but you'll be stigmatized for it. Anything that's worse than that is something that's illegal. A murder, well, that's worse, but that's, they'll put you in jail for that.
So you want to be a good multicultural counselor. But like you said, a lot of it is now, it's just grandstanding usually it's usually just like white privilege or male privilege or both. And that's pretty much it. White or male or white male and or Christian, and that's pretty much it.
Welcome to the Reality Therapy Podcast, where the truth will set you free.
I'm wondering what you see in regards to race within the mental health fields. I see a lot talking about we need to deconstruct whiteness and decenter whiteness and all this stuff. And I honestly don't know what that has to do with like a one-on-one relationship in the therapy office, but it's apparently a big deal in our field. So I'm wondering what you're seeing.
The privilege walk is one of the things, like that never existed whenever I was working on my master's or my PhD. I'd never heard of this. And so when I first saw it, I'm thinking, this is disgusting. Like, why are you trying to single out people that their parents are married still to this day, or parents are not struggling with poverty, or, all the things that are listed on this privilege walk? It is nauseating how they're trying to single people out. I think it's absurd. I think that we need to be able to find a way to connect with people based on what they're sharing with us, not the color of their skin, not the gender that they were born into, assigned at birth, believe they are. Just be with your client, talk with your client, understand their situation, and help them explore it so they can gain insight into who they are and what they're doing, how they're projecting themselves into this world. And if they don't align, let's help them find some congruency. That doesn't mean affirmative therapy. That means if this is how you see yourself, how are you exploring this in the world?
Something that it seems like to me is that we miss out on a lot of the useful aspects of multiculturalism. And kind of what I'm thinking is the general formula seems to be whiteness is a bad thing, masculinity is a bad thing, heteronormativity is a bad thing. Therefore, you should have far left-wing politics. But explaining how to work with different groups actually doesn't happen a lot. And an example I have is in my multicultural class, they talk about, they mentioned this kind of condition called ataque de nerviosa, I think it's called. It's like a form of anxiety rooted in jealousy that's very specific to Latina women, to Hispanic women. And I was like, can we talk about this? Like, I don't understand this. Like, I don't understand how this manifests. Can we kind of flesh this out a little bit? And the professor's like, no, we're not going to get into that. The point of the story was like a white male therapist is going to do it wrong, but she wasn't going to tell us like the right way to do it. And so afterwards, I asked a couple of my classmates, I was like, can y'all explain this to me? Two women from Mexico. And they explained it in a lot of detail to me. Like, okay, that makes a lot of sense. And from those two classmates of mine, I learned more about multiculturalism, like actual multiculturalism, than in 2 years of graduate school. So to me, it seems like even though we say these words multiculturalism like quite a bit, to me, it doesn't seem like we're actually talking about it. It's like we're talking around it. I'm wondering if you see the same thing.
Yeah, absolutely. And one example is kind of similar to yours is I think I've learned more from my peers from different cultural backgrounds directly than from the lectures. And sometimes that just comes out in the responses. And the example I'm thinking of specifically is headdress, religious headdress. So women who are from a Muslim background and they'd since left the faith, what their experience was with regards to that. And the way they described it was very it's very rooted in their experience, but very much in opposition to what was being discussed in the lecture, or at least the level of detail that's being discussed is be sensitive if you're working with a young woman who works, who wears a burqa, because, you have to work within her belief system. But it wasn't never brought in the potential for, was that, enforced upon her, or is actually oppressive? And my peers who discussed it were actually saying, well, our experience is it was, and we were, and I wouldn't want my daughter to experience that, and etc. So of course that doesn't represent everyone, but it was really a stark difference, because the way it was delivered to us was saying any difference, unless it's whiteness and masculinity, as you say, has to be respected, and you shouldn't question it. If they question it, maybe you can entertain it, but we also don't really talk about that. If they are different, you have to assume that any assumptions that you have about that potentially being bad is your prejudice, and that's something wrong with you. But to us to think about whether or not the system that they come from is genuinely oppressive, no, that's just you being, that's you having your prejudices. But to hear it from Middle Eastern women who had experienced it was like, it was great because it was straight from their experience. So it was easier to riff off that. But I was thinking about it and I thought, if they hadn't said that, I might not have felt able to build on it or to say, yeah, no, I agree. I was also going to say, maybe that child is finding it difficult to cope with the fact that she's been forced to wear a hijab, just as an example. But because it's 3 women who were from that group, it was easier.
I think a lot of times, like, our cultural diversity training is kind of like, it's kind of like, what does the bulk of this group tend to prioritize? But that doesn't solve your problem,
Yeah.
because you still have, variety and outliers within those groups. At the end of the day, you still have put all the cultural diversity training on it you want. You still have to be client-centered and curious to navigate those kind of situations.
Yeah.
I really believe that, and that's and that kind of ties to ideas of more related to like classical liberalism, and I can believe what I choose to believe based on on spiritual priorities or based on my own life history, learning history, and I don't have to be in a category.
As I was saying before, you have to make this calculation before you decide how to treat people. Because like if I was your client, I came to you and I said, listen, I believe in traditional gender roles. Kind of what we're taught is, okay, this client is backwards. They're probably bigoted. Something inside me needs to work on changing something about them so they can kind of overcome this prejudice. But then you find out, oh, no, I forgot to tell you, I'm actually a Muslim. So now I have to change my thinking. I have to respect this client's culture. You have to like change your intersectionality score in a sense.
Yeah, no, that's a good way of putting it. No, that's exactly it. It's like, if it comes from a Western or white or patriarchal angle, or they can at least frame it that way, always bad, always criticized, should be, worked on as a problem. But as you say, as soon as it's outside of that, it's like, that is difference. You need to respect difference. So it's never evaluated on any real basis. It's just, if it is outside of you and your identity, don't ever feel privileged to talk about it in a critical way.
I'm not sure if you read the Daryl Dwayne Sue book, Counseling the Culturally Diverse, but the list of potential microaggressions, it could extend on indefinitely. Asking an Asian woman what she eats for dinner, saying that I believe America is the land of opportunity, saying that I believe men and women are equal. Almost anything that you could think of could potentially be an offensive microaggression. That has got to do some serious damage to the therapeutic relationship if you take it seriously.
Yes. So this was not in my PhD program, but it was when I worked as a case manager. I went to a microaggressions training. And just so that people can put the timeline together, this was probably in 2013, maybe even 2012. Okay, so this is a long time ago that I did this microaggressions training. And the way that it was taught, which is, I think, consistent with how Sue describes it, if you're white and you're accused of a microaggression by somebody who's not white, you are always guilty, no matter what you think you did, no matter what you did, and no matter what you think your intention is. They're always right and you're always wrong. And you can never be the victim of a microaggression if you're white, no matter what happens, no matter what anybody does. So I don't think you have to go deep into the construct to see why it's so hateful and dysfunctional. It's really pretty close to the top that this is obviously like kind of a deranged worldview.
It just seems so, unfair is the word that's not quite what I'm thinking of. But it's like, if you define the terms of a debate before the debate even starts, there's no debate. It's like saying, would you like to play a game? Yeah, sure. What are the rules? The rules are I win and you lose.
Yes.
That's the rules of the game. That's it.
It's all or nothing. I mean, it's very clearly splitting, which I've written and talked a lot about, where you just have to frame groups of people in these opposite all or nothing terms. One can never be a victim. The other is always a victim. One is never right. The other's always right. One's feelings are always valid. The other times they're never valid. One's always a privileged oppressor. It's such a dysfunctional defense. And it's obviously seen as being psychopathogenic, and that's why treating splitting is so central to so many different treatment approaches. It's the foundation of DBT, a lot of psychodynamic, psychoanalytic approaches, a lot of cognitive behavioral approaches focus on addressing splitting, addressing all or nothing thinking. And so it's pretty shocking to see a worldview that obviously frames entire demographic categories in these all or nothing terms really rise to such prominence in clinical fields.
And it almost feels like there's an idea behind the idea, where it's like, it's not just kind of being respectful of other cultures or being knowledgeable about what you might encounter from a person of a different ethnicity. There's some kind of ideology behind that. And I'm wondering if you see any of that kind of multicultural influence in your field.
I would say yes and no. I mean, I think it's something you see in mental health in general. I think it's an idea that sort of widely disseminated and accepted, and certainly in academia. And I think, when it comes to mental health, there certainly is some validity in the sense that, we work with patients of all sorts of backgrounds, different, whether it be ethnic, cultural, otherwise. And I do think it's important to, we as clinicians, I think it's important for us to be able to work with people of different backgrounds. That's important. So I do think there's, on some level, there is some value in us as clinicians knowing about different cultures. Arguably there's value in having, in terms of the pool of clinicians, having diversity there. So there's some value there. On the flip side, I don't think we don't want that to be the only lens through which we look at someone, or we don't want that to be the only type of diversity that we see within our field. Because there's a lot more diversity and range in our patients beyond just culture or ethnicity. Whether you're talking about religion, whether you're talking about, socioeconomic status, or even, political orientation. I think a lot of the people who talk a lot about multiculturalism, if you were to propose, we need more ideological diversity in our field, they likely would have a very different opinion on that. So it's interesting how certain types of diversity gets prioritized. And other types less so. And ultimately, my opinion is, I think, yes, diversity is good. It's important. I think we as a field, I think we benefit. And I think we're seen as more trustworthy when we can demonstrate that we value diversity. But it has to be diversity in every sense. Yes, cultural and ethnic, but all those other things beyond that.
So it seems like there's one side saying this is the only conversation to be had, and it has to be had from this very specific angle. And kind of the flip side of that, on the more conservative side, you often see this take of, I don't like the way this conversation is going, so let's ignore the race question altogether and let's just not have this conversation. This conversation makes me uncomfortable. Let's just change the subject. How do you kind of navigate those two extremes?
Yeah, that's a good explanation of sort of colorblindness versus anti-racism dilemma there. And so the way I look at it is, look, to some degree, both sides have a point. I'd probably lean one more way or the other, but I admit the other have a point. I tell people sometimes I am anti-racist, sometimes I'm colorblind. As a professor, when I grade my papers, I'm colorblind. Sometimes I see these situations, I see it from an anti-racism perspective. So it's not that you are always right and you are always wrong, or vice versa. We need to figure out, what we have in common, where we can work together, how we can hear from each other. Because I suspect that a lot of the people on, let's say, the colorblind side don't fully appreciate what the people on anti-racism are saying. Now, some of the people on anti-racism are saying it in very bad ways, in ways that are not conducive to being heard. But the people on the colorblind side don't understand that, and vice versa. That the people on the anti-racism side don't always understand why people feel the way they do on the colorblind side. And so if we understand each other and understand the needs each other may have, then it becomes possible to find a solution that can meet as many of these needs as possible. And I think that that's what we need, because that's what's sustainable.
I'm, in grad school to become a therapist, you started seeing clients, things like that. And I feel like my education on race and multiculturalism has been very subpar. And, it seems like the worst of both worlds. It seems like, on kind of the left-wing sense of things, it's a heavily politicized, kind of obsession with multiculturalism. But on the other side, it's almost colorblind in the sense we're not actually talking about it. The formula seems to be like, whiteness is problematic, therefore you should have left-wing views. But we never actually talk about how would I counsel a Latina woman or a black man with depression. Like, we never actually get into those actual issues. It's just kind of very superficial and political. So if you were advising a therapist or someone teaching therapists, what would you tell them that they need to know about multiculturalism and race specifically?
Yeah, I would say, need to learn some of the cultural differences because to me, it seems like that would be very relevant to a therapist. I'll just give you one example. For the African community, titles are very important. Excuse me.
That's you.
Titles are very important. Titles are important for African Americans historically because we were denied our titles. You could become a doctor or a lawyer and you're still called a boy or by your first name. Whereas we had to, and so when you go to the black church, suppose a white church, it's always pastor or reverend. It's never Bob or Jane. And in white churches, it can be that way. Now, I think that that's an important cultural element to be aware of if you're counseling African Americans. It may not be relevant. It probably won't be relevant in a lot of situations, but sometimes it may be relevant. Why a person feels his or her title is so important and wants to protect it and respect it in a different way that you might expect from European Americans. Well, I find European Americans, they emphasize lack of titles because they're emphasizing equality. And so I'm not criticizing European Americans for not emphasizing titles. I'm just saying it's different. I'm not talking criticizing African Americans either. I'm just saying it's different. And those are the differences that you would want to be aware of if you are dealing with counseling different cultures. You can't learn about all cultures. So my recommendation is if you're in a community that tends to have certain types of cultures, you should learn more about those cultures. You can learn, through books. You can learn through having people over and talking to them about, asking them questions. But I would emphasize cultural knowledge more than, I would not want to get into the sort of the political dynamics of multiculturalism and that sort of stuff. Because I think for your profession, that's less useful.
There's this sense that I get from the multicultural training that I receive where any kind of traditional understanding of how to do things like the scientific method would be a symptom of white supremacy.
Yeah.
And so they've kind of got this kind of way off the rails conception of multiculturalism that kind of makes all of our thinking go haywire because you're afraid of stepping on these little tripwires. I'm wondering if you see anything like that.
I mean, thankfully, no, it's not something I myself have a ton of experience with. I've definitely heard stories, similar to what you describe. And I think if you do delve more into sort of the academic pockets of mental health, I think you see this stuff more. It does, I think at the very least, a lot of that stuff is silly. I think a lot of the time it's worse. It's counterproductive on many levels. It's not healthy to see every single thing through the lens of culture or ethnicity. The scientific method, to use your example, the scientific method is the scientific method, and it's valid for people of any racial or ethnic background. And to claim that it belongs to a particular race or doesn't, it's ridiculous on its face, and it's almost silly that we have to debate that. So it's unhealthy to see all of these things through that lens. And arguably, it sort of demeans individuals of other ethnicities to say, if these individuals are arguing the scientific method is related to white supremacy, does that mean that individuals who are non-white, that they are incapable of understanding the scientific method or using it? It's really silly and offensive when you think about it. So it just kind of, there's maybe a grain of rationality in all this, in the sense that, yes, I think it's important to be aware of different cultures might have different attitudes on certain things, but you can't let it go to such an absurd level where you describe something that's fairly universal, like sort of understanding science, knowing how to use the scientific method, and saying that that's the domain of one particular ethnic group.
Yeah, I agree with all that. I heard someone say aspirin works in every country with every race or ethnicity. That type of science, that type of medicine, I'm sure a lot of what you do would be fairly universal. There may be some different kind of perceptions that you would get from different cultures, but the basic idea of how a lot of this science or medicine works is going to be a universal.
Exactly. Right. And it's funny. I mean, one thing I do see that has changed is like, I remember, when I was in medical school several decades ago, they would talk about sort of working with individuals of different ethnicities. One of the things they taught us, which I agreed with, and it made a lot of sense, was, you don't stereotype people based on their ethnicity. So if you see someone of a given nationality, ethnic group, what have you, you shouldn't make assumptions about this person will be like this, or this person will want this, et cetera, et cetera. The idea was, we should treat individuals as individuals and treat them equally. I think you and I would both agree with that. And to us, I think to the vast majority of Americans, that would make perfect sense. But I think in some programs right now, you sort of see the opposite, where you're supposed to see a person solely through the lens of their ethnicity. And you're supposed to make all of these assumptions about them that, people of this ethnic background, they're X, Y, and Z.
There seems to be, and this is kind of what I see from a lot of social justice activism broadly, but it's certainly true in my program. And like the assumption is, if you're a good ally to racial minorities, then you need to have far left-wing politics. And from many racial minorities that I've worked with or been friends with or coworkers with, there tends to be a wide range of very nuanced opinions on these issues. And the way it's presented in a lot of the social justice literature is very one-dimensional and kind of surface level presentation of like, this is Black thought. Whereas like, if you look at just, some of the top Black intellectuals, they're all across the board politically.
That is true. I mean, it is ironic because one of the things that we tell, one of the things of white privilege tenets is that you're not speaking for the entire white race when you speak. And yet some of those same people then say, well, but this is the Black thought. So there's a sort of ironic type of hypocrisy about that. Yeah, African Americans were varied as any other group as far as our thinking, and I think we're seeing more and more of that, even politically, in the coming years.
We shouldn't assume that everyone is exactly the same. But ultimately, we don't want to become so obsessed with that we just attach stereotypes or assumptions to someone based solely on what we're seeing of them. I think this approach that I described from several decades ago, where we were taught to, you don't stereotype, you don't make assumptions, you treat a person as an individual. To me, that is much more sensible and healthy. And again, I think the vast majority of Americans would agree with that. I think when you get deep into academia, I think you'll see more varying opinions.
And I've been told by multiple professors that CBT is inappropriate to use for racial minorities because rationality is racist. That sounds just bizarrely offensive to me, and I'm wondering if you have a take on that.
Yeah, I mean, my initial take is offensive. Yeah, I like to think of myself as a rational person, so that is offensive. I think that's a political statement more than a racial statement. I mean, I don't know if they know how it sounds when it comes out of their mouths. I think that's one thing that goes with identity politics, that you lose a certain amount of rationality because winning the political victory becomes everything. And if you have to sacrifice rationality in order to do it, then you do. And once again, that's true on the left and the right, but I think that this is an example of that.
Yeah, it's like so much of it seems like it's some mission to right a historical wrong. Like this one-on-one relationship we have in the therapy office can never accomplish its goal of helping someone with their mental health until we first address this issue of white privilege or decentering whiteness. So that that type of mentality, this political obsession kind of is taken over the field, it seems like.
Well, I think that is the primary way that the aggression manifests. And I'll just reflect on my training. And I don't think it's unique to psychology. I think these are cultural norms across the West. White people as a group can be insulted, often quite viciously. Fragile, privileged, weak, sinful, immoral, toxic. They need to be abolished and dismantled and discriminated against. And there's lots of quite sharply aggressive language that's routinely, whiteness is pathological narcissism. Whiteness is a parasitic condition. These are real articles that were published in academic journals. So there's a lot of that. If I were to talk about any positive strength or dynamic related to white people, I would likely face severe backlash for doing so. So this is a category that at least the culture in academia, and I think beyond, is that you can say very harshly critical things up to very aggressive things about them. You cannot compliment or defend them. And if you look at other groups of people, other demographic categories, they are often praised and celebrated, often in really idealized, grandiose terms. They're strong, noble, righteous, beautiful, wise, awake, enriched spaces that are needed, that need to be empowered and voiced, and so on. But to talk about any negative or trends or dynamics in those groups is seen as unacceptably racist. That framing of you can only say bad about one and you can only say good about the other, that is splitting. And it's broadly internalized throughout our society. If you say something in the other categories, people lose it. They cannot tolerate it. And I think that that schema has been very deeply internalized, yes, in the mental health field, but I think well beyond it. And it's that framing that's the primary vehicle for aggression. It's saying that this is an all bad category, that it's forbidden to say anything positive about, and these other categories are these all good categories where it's forbidden to say anything negative about them.
Yeah, I mean, I've worked with a number of racial minorities. My background is in addiction treatment, and you use CBT principles all the time. And people tend to be, people of all different races tend to be grateful because they find them empowering. Here's some tools that I can hold on to that are going to empower me to take more control of my life. And it seems like that goes against the mentality of, kind of the mindset seems to be you're supposed to encourage people to adopt a victimhood mentality. One of the bizarre things is they would say if you have like a heterosexual middle class white male client, you can use kind of these gold standard tools like cognitive behavioral therapy. But if it's any kind of racial minority or a woman or a gay client, you need to essentially be kind of like affirming victimhood. And to me, that's like the most privileged clients get the best therapy, and more marginalized clients get worse therapy. Like that, it just seems so counterintuitive.
It seems to me that to just generalize, say, if you're from this group, this is how you think. Yeah, there may be tendencies, but I think it seems to me that you would want to make sure that you're approaching this person individually in a way that's useful and productive. That's what it seems to me it would be like.
I'm wondering if you've seen any push to bring some of this ideology directly into the therapy office. Like you have a white client and it's important to educate them about their privilege and things like that.
Oh yeah, there are people who say you need to do that in every session. For sure. But I don't know what the breakdown is. Again, going back to that bias scale, I don't know how many people are really at that 0 level. And there are definitely people who write articles advocating for that type of care. And they often have very high rank positions at the APA or universities. But I don't know how often that's happening in the actual therapy world. My guess is that it's a meaningful minority, but that there's far more in the very biased category above it.
So one of the things you run into, this is another interesting one that I see, is challenging or confrontation with a client. So a client might be doing some kind of self-destructive behavior, drugs, for instance, in their life, and kind of what we're being taught is, again, the more privileged client, your middle class, heterosexual, white male client, confrontation is like appropriate. Hey, is your cocaine use contributing to your financial issues and your issues in your marriage? Let's look at this. Kind of like confronting the problems head on. And if it's any type of marginalized client, like a racial minority, you're skirting around that. And so it seems like the more directness is giving better care to a more privileged client. I'm wondering, like, is there something like in like a sociology of race issue where like it might be inappropriate for a white therapist to challenge a black client, or would it be more appropriate to address that issue more directly? How would you see that?
Yeah, I think that's an interesting question. I think it's going to differ for different people. I mean, even there's some whites that you would not want to confront directly. I mean, I've had white friends that have had problems that I knew I could not confront them directly. So I don't think this is unique to just people of color. A person of color comes in and they have more of an anti-racist mentality, and they have a white therapist. First thing is maybe they don't need a white therapist. I mean, just to be honest, maybe this time we can't be colorblind. because maybe for this person, for the person to say what they need to be said, maybe they need to hear it from a person of color. If that person retains as a therapist, then I think that the therapist has to find ways to communicate with people. My understanding of Asian American culture is that this is also a big issue as far as confrontation for a different reason. That Asian Americans don't, in certain types of ethnicities, tend to, direct confrontation does not work well with them. That doesn't work. There's issues of shame and things of this nature that you have to be aware of. I just would suggest that, consider whether or not you, that this person really needs a person of his or her own race as a therapist. And then if they retain a different race therapist, that person needs to adjust. But I think they would have to adjust with certain whites who do not want confrontation as well.
I was particularly concerned about critical race theory. I can just give you a little bit of background to how this came about. Back in 2020, with the death of George Floyd and the subsequent BLM protests, I could see what was happening and I was really worried about it. And I joined an organisation here in the UK called Don't Divide Us, which is very similar to FAIR in the US, okay? They call themselves the UK voice of common sense on race. And basically, we believe in the colourblindness approach. We're great fans of Coleman Hughes on that level. So I joined them, and shortly after I joined them, I saw a documentary which is about children aged 11 in school here in the UK who had a 3-week course of critical race theory to try and help them not be racist. And I saw these wonderful young children, 11-year-olds. They all had friends of different races and different ethnicities, different religions. They all got on. They were colourblind. They were happy. After the 3 weeks of critical race theory, these children were resentful. They were really angry with the world. They declared the UK was a racist country. And I thought, this is not right.
11-year-old.
Right. 11-year-olds, Ryan. 11 happy, carefree children with friends. There was one little boy who was white, whose best friend was black, and they were divided into groups. They were segregated into black and white groups. And the kids in the black group were having a wonderful time, and the kids in the white group, as the commentator said, it looks like they've gone to a funeral. And I thought, this is abusive. This is not right. I don't think this is right. And I took it up with the British Psychological Society, who would have nothing to do with it. They just said, yeah, no, it was fine. They followed all the right guidelines. We had psychologists there. Little children were weeping, Ryan. Little white kiddies were weeping because they'd been separated from their friends. So I thought, enough. I do not think this is right, and I'm going to try and do something about this. And so critical race theory, I think, was my focus, really, to try and raise alarms about it, because I felt, having watched Jonathan Haidt actually giving one of his talks about how Greg Lukianoff had recognised that this is a kind of form of reverse CBT that is being taught, always trust your feelings, catastrophise about everything, binary thinking. So I decided I wanted to do something about it. And I wrote a piece for Don't Divide Us, which was put online. And quite by coincidence, a colleague of mine mentioned this to Val Thomas, who is the editor of Cynical Therapies, and said, why don't you get in touch with Carole and see if she'll write this chapter for you? So Val did, and I was delighted to do it. But what was also even more delightful, actually, was to work with Dr. Dina McMillan, who is an absolute, you should get her on your podcast. She is amazing.
I'd love to.
She is amazing, right? She and I contacted each other because we were both writing on critical race theory. And I said to her, look, I've got this idea that I want to treat critical race theory as if they're a person and put them in the therapist's chair. This is what I wanted to do, so that you can actually begin to see their thinking and how harmful potentially it is, both to a person who thinks that way and to all their relationships. And Dina said, wow, I love that idea. She said, can we both do that? She said, what about you write from a white therapist perspective and I'll write from a black therapist perspective, and we can actually bring more understanding into how critical race theory would see each of us, and respond to us. And so that's what we did. I mean, it was hard work, but it was a lot of fun as well, because I hope that we managed to get the message across. And with Dina's experience, I mean, she's an African-American woman. She's experienced the most appalling racism. And, and I just feel I'm amazed at her, because even in spite of that, she says it's the way you respond to it. It's this idea that you can't change what has happened, but it's how you respond to it that is really important. And she had a great understanding of critical race theory. So together, I think we managed to create something that hopefully was useful for people. But that's how I came to write it. And as I say, I drew a lot on Lukianoff and Haidt, because I think they absolutely nailed it, this idea of reverse CBT, where all the ways of thinking, the cognitive distortions, that played out, this is part of the way that critical social justice encourages people to think. And it's unhealthy. It's linked with anxiety and depression. Why would you teach people to do that? And maybe that explains, going right back, Ryan, to the first question when we were saying, why are people, why are they so worried all the time and so anxious? Because this is the way they're being taught to think.
It's even more than conservatives and Christians. It's really like when you add up how many people have a non-leftist view on something. And like in ours, we were talking victims of anti-white aggression or people falsely accused of sexual misconduct. Plenty of liberals who've had those experiences, who might want to talk about it in therapy. They're still liberal, but they still can't find a therapist. So I think when you add up all these overlooked populations, it's the large majority of patients. And it's shocking, because cultural competency is really, it's a Trojan horse for leftist orthodoxy. And it's just race, gender, sexual orientation, maybe immigration status, not even class, really, to be honest. It's just demographics. And even then, they tend to do a poor job of understanding this, because like how many, immigrants are religious, or how many like Black patients are Black men who have masculinity concerns. Like, it's like, even among the groups that they're prioritizing, they often don't prepare people well, because it's so ideologically narrow that it's likely to be misattuned to a lot of them.
Imagine someone who's in a grad school classroom or in a continuing education credit course. They're there, and something really that like upsets their spirit is said. And it's like, I want to push back, but gosh, I don't want to be called a racist today. I don't know if I have the energy to be called a bigot today. What would you say to that person?
Well, I would say, like, I just wholeheartedly reject that premise. Like, if somebody says that about me, like, I absolutely reject it, because I know that I'm not racist, and I just refuse to accept that label being put on me. It's not true. And like, I'm sure Nazi, good Lord. So like, no, so like when those like hurls and insults are like getting thrown out, just like, that's absolutely false, and just wholeheartedly reject it, because it is not true. And I don't know how well that works. It's not true. So I refuse to accept it.
When you look at kind of just across the board with classes in multiculturalism, DEI trainings, diversity trainings, that type of thing, if you could kind of wave a magic wand, how would you fix that or improve that?
Implement principles that research has shown has some positive effect. For example, I would almost get rid of completely the person standing up front talking to 100 people model. I would want to focus on skill development, developing skills of learning how to take the perspective of others. I would want to focus in on elements such as communication skills, learning how to, having people realize what's vital and what's extra in what they want, so that they can hold on to the vital and give away the extra and compromise to get support in that. So I would focus in on those sort of elements. And programs that are doing that, those programs, I would shovel the resources to. Programs that are not doing that, I would let them dry up.
So you brought up anti-white aggression. And I want
Yeah.
to say you're the first person who I've ever heard phrase it like that. And I know myself personally, when you look at DEI and critical race theory and these type of things, something's very off about it, right? But when I talk about it, it's like, well, this is an inefficient way to reach our outcomes, and you just kind of come out, this is anti-white aggression, which, I mean, there was 2 Harvard professors who said our goal is to abolish the white race. Like, it's not like what you're saying is really all that controversial. Why is it so hard to just say that out loud?
Yeah, I think it's important to be able to talk about issues like this. I think even if we, we want to get along, we want to have a healthy society. It's hard to do that when there's this giant issue that people can't talk about. I run into this all the time. I'm actually like, I don't know. I don't seem to have the same type of, for whatever reason, I don't have the same type of inhibitions against talking about it that a lot of people do. But it's clear to me that when this issue comes up, people become incredibly dysregulated and their reflective functioning basically collapses. They can become very angry and paranoid, and they start to split in one direction, or they dissociate or repress or become very anxious or shut down in the other direction. And the number of people, like, I think you're right, the number of people that I see who can talk in a non-hateful, pro-social, like, constructive way about this topic is close to zero. And I do think of this as a psychological problem. People are really unable to say, like, I don't want to be hateful. I strive not to be. Like, I don't want that in my life. I don't think it benefits people. I want us to be able to get along as a society. This issue, if we don't talk about this, I think that, let me put it a different way. I think a great deal of the chaos of our political moment is a result of our inability to talk in a genuine way about this. And it can't be left. The only people talking about it can't be people that are super angry.
Your book, Beyond Racial Division, A Unifying Alternative to Colorblindness and Anti-Racism. Could you just give me a little rundown of what that book is about?
Yeah, so I do try to, I critique colorblindness and anti-racism and try to look at the research showing why they're not working. I approach it with a Christian perspective. And so I also make an argument about human depravity and what I call a collaborative conversation approach, which I think is a better way of handling it. I make a theological argument as well, therefore. And I do try to end with some practical ways in which we might try to push forward on it. And so it's trying to find a way where your side doesn't have to win in order for you to implement this. You don't have to, beat back all the anti-racists or all the colorblindness so that you can do what you want to do, because you're not going to keep them beat back forever. We can find ways we can come together and find solutions that we can agree upon and work together on.
Like, if you have a family, let's say you're doing family therapy, and they say aggression towards all the members of family is wrong except for to this one family member. If you want that family to get along and have a healthy dynamic, you need to say, hey, aggression towards that family member is also wrong. And the family may need to learn that. They may be uncomfortable with hearing that at first, but how are you going to have a stable family system if you can't say that? So I don't understand how we get to a place of stability or ethics or justice or anything if we can't talk about this issue. And it's really, I think it's a major problem, which is why it's worth maybe taking the risk to talk about it. I do think our society is going to get there, but it's shocking to me how difficult it is for people to talk about this candidly.
What have you seen in the field of therapy and clinical psychology in terms of anti-white bias?
I mean, I think, like, just to stick on this issue, I think it's, like, really stunning that it's bias and aggression directed at white people is so systematically excluded as a clinical concern. It's like, the way that it often gets framed is that aggression against white people isn't racism. And the reason why they seem to want to make that argument is to say that it's less important or unimportant, or maybe even okay, or maybe a good thing even. I think there are people in the field who would argue that anti-white racial aggression is good or needed or something. But I think the biggest thing that just strikes me is just, like, there's no services, there's no resources, there's no trainings, and there's no literature. I think if people could really just hear case studies of what people actually experience and how it impacts them, we need data and we need to tell those stories. I think it would really actually have a profound impact on the culture if we could actually do that research and tell those stories. It's very hard to find faculty that are willing to do that, but that's the biggest thing. And if you experience it and you go find a therapist at random, the chance that that therapist thinks, well, you're privileged, so it's not really racism when it's like, it's not negligible. Maybe it's depending on where you live, it's a majority or not a majority of therapists, but it's not a negligible percentage that could actually compound the issue by stigmatizing you. I mean, it's crazy that people experience this and then describing what happened to them, they're afraid to talk about what happened to them because they'll get attacked for it. It's just totally obviously unhealthy and obviously immoral. Like, I think racial aggression towards everyone is wrong. It's deeply believed. I think that's a sacred truth. It's stunning to me that there's this form of racial aggression that we can't say that about. And I think that's really the root of a brokenness around ethics, around reality, around emotion regulation. And I think it's really spreading a lot of the chaos that some of which seems unrelated, but I think it's just kind of rippling out.